So today I'm going to talk about anemia and two herbs, Dongui and Huang Qi, that we use to treat anemia in Chinese medicine. And I'll talk a little bit about how we think about anemia in Chinese medicine. So anemia in Western medicine has a very concrete way and approach of looking at it. Typically, in Western medicine, we measure a patient's hemoglobin level, and if your hemoglobin is below a certain threshold, you have anemia. That's the straightforward diagnosis of it. There's different thresholds depending on your age and gender. Just loosely, though, for an adult person, your hemoglobin should be over 12 approximately. If it's less than 12, you have anemia in general, and it can vary, like I said, based on age and gender, but that's just some loose approximations. So in Western medicine, then we can break down anemia into all kinds of different types. There's iron deficiency anemia, there's thalassemias, there's folic acid deficiency, B12 deficiencies, macrocytic anemias. There's all kinds of different anemias, but in general, we define anemia as a hemoglobin below the threshold. Now, in Chinese medicine, it's a little different. We don't use blood work to make our diagnoses. We don't, just draw blood and boom, you have the answer. In Chinese medicine, it's based on your physical exam and your signs and your symptoms. And interestingly, what we would call a blood deficiency in Chinese medicine, we don't really use the term anemia, but we use the term blood deficiency. A blood deficiency in Chinese medicine does not necessarily correlate with anemia in Western medicine. So, for example, you could have a normal hemoglobin in Western medicine, but you could still have blood deficiency in Chinese medicine. And vice versa. You could actually have a anemia in Western medicine, but maybe you don't have a blood deficiency in Chinese medicine. So it's not a one-to-one correlate, but they oftentimes are associated. A lot of times, if you do have anemia in Western medicine, you probably have some aspect of blood deficiency in Chinese medicine. Now, the herbal combination I was talking about today is Dongui and Huang Qi. Now, Dongui is an herb it's probably one of the most common, if not the most common herb that we use to treat blood deficiency. And it's a special herb because it directly tonifies and builds up the blood in the body, and it also helps to move the blood in the body. So it kind of helps to nurture it and then also send it along its way. And then the second herb that sometimes that we use together with dongui is an herb called Huang Qi. And Huang Qi is it's a different category of herb. It's a type of herb that builds up the qi in the body. And it has a unique function in that it builds up the qi that then goes on to help transform and produce blood in the body. So you're using a two-pronged approach. With dongui, you're directly building the blood, and then Huang Qi is kind of building the supplement for what eventually becomes the blood. So it's a commonly used combination in Chinese medicine for blood deficiency, dongui and Huang Qi. And so that's one aspect. So if you come to our clinic with anemia, we would look at you and examine you from a Chinese medicine perspective and see if you do have blood deficiency. And if so, what type of treatment you might need. This is one example of a treatment that may help you if you have anemia in Western medicine. All right, we'll see you next time.